A bit of health now. About 60% of known infectious diseases and 75% of emerging infectious diseases are transmitted from animals to humans. Experts now fear that Nigeria may not be so prepared to tackle outbreak of such diseases effectively due to inadequate funding. This is why a project which is focused on encouraging increased sustained funding for epidemic preparedness and response was created to ensure that the country has a chance for a better health security system. Correspondent Kemi Balogun has details.
There are public health institutes that are funded to support the country when there are health emergencies.
The envelope of NCDC is not enough to be able to meet all that is required based on its money.
The healthcare system has experienced underfunding for decades, leading to untold hardship for Nigerians seeking medical care. This has raised the level of anxiety during outbreaks of diseases when citizens do not get access to proper care. Particularly worrying over the past few years is the possibility that new diseases may emerge or existing ones will mutate into deadlier and untreatable versions.
Prevention and
the Nigeria Health Watch, alongside other civil society organizations advocating for better healthcare outcomes in Nigeria, conceived an idea to use this documentary project to reach out to stakeholders to advocate for better funding for epidemic response and preparedness.
Health has been underfunded in Nigeria, and this cuts across everything from health system strengthening to primary health care and to health security as well, epidemic preparedness and response. So in 2018, this project was conceived called the Prevent Epidemics project, and the sole purpose was to advocate for sustained increased funding to epidemic preparedness and response at the national and subnational levels. Our healthcare is decentralized, right? The tertiary level of care is the responsibility of the federal government. The secondary level of care, responsibility of states. Primary healthcare is primarily the responsibility of local government areas, right? But we have found that the local government area is the weakest link of government in Nigeria. And that's interesting because outbreaks actually start in communities. They start at that level, at the local government area.
It is important that in responding to public health emergencies, a country's response is critically assessed. Presently, the project has helped to increase funding in some areas for epidemic response at both national and subnational levels.
With the advocacy efforts, employing media and advocacy with lawmakers, legislators, and heads of agencies. One of the things that then happened for NCDC's budgets in 2020 was that I think 100 million naira was added to their budgets. And then in 2021, they had a 75% increase in their allocation.
But a lot more needs to be done to put other states on the map too.
One in supported states being Lagos and Kano State.
A country-specific activities, and it was costed the 5 years plan.
A joint external evaluation for epidemic preparedness was done in 2017 and 2019, with a slight rise through addressing the gaps that were noticed. Nigeria has a steady rise in its evaluation from 39% in 2017 to 46% in 2019, but there is still a constant need for advocacy in order to get more funding for epidemic preparedness and response. Concerns, however, continue to grow as some of the seasonal endemic diseases such as Lassa fever and yellow fever persist throughout the year, and emerging ones like monkeypox are persisting even on a global scale in recent times. As the world population increases and humanity encroaches on wildlife environments, it has become a lot easier for epidemics to increase, with some of them spreading like wildfire. Kemi Balogun, TVC News, Abuja.